Some wounds you just can't see. They don't bleed. They don't show up on an X-ray. But let me tell you, they are as real as a broken bone. This is the reality of post-traumatic stress disorder, or PTSD. It's a serious condition that can follow a terrifying event. We're talking about an injury to your mind, your spirit, and your sense of safety in this world. It's not something you can just get over or toughen up about. This is a real medical issue that requires real targeted attention. Ignoring it is like ignoring a gaping wound. It's only going to get worse. So, let's get real about what it is. So, what exactly is PTSD? Let's break it down. Imagine your brain has a filing system. A traumatic event is like a file that gets stuck in the urgent tray. It never gets properly filed away into your long-term memory. Instead, it stays active, and your brain keeps reacting as if the danger is still present. This isn't a character flaw. It's a biological response to an overwhelming experience. Your mind is trying to protect you, but its alarm system is broken. It's stuck in overdrive. It's a psychological scar left behind after you've been through something no one should ever have to go through. One of the biggest symptoms is reliving the trauma. You're not just remembering it, you are experiencing it all over again. This can come in the form of flashbacks, where you suddenly feel like you are right back in that moment. It can also manifest as terrifying nightmares that rob you of your rest. You might be driving down the street, and a loud noise sends you right back to the battlefield. You might smell something that triggers a vivid, horrifying memory. These aren't just bad memories. They are intrusive, powerful, and they feel like they are happening right now. It's exhausting. Then there's avoidance. Because those memories are so painful, you start doing everything in your power to avoid them. You might stop going to certain places or seeing certain people because they remind you of what happened. You might avoid watching the news or even talking about your feelings. Another thing we see is emotional numbness. You might feel detached from your friends and family. Activities you once loved, like fishing or playing with your kids, now feel meaningless. It's like the color has been drained from your life, and you're just going through the motions, disconnected from everything and everyone around you. Now, let's talk about what causes this. The most obvious cause is experiencing a trauma directly. This could be military combat, a violent assault, a car crash, or a natural disaster. But it's not just about what happens to you. You can also develop PTSD from witnessing a traumatic event happen to someone else. Seeing something horrific can leave a deep and lasting scar on your mind. Even hearing about a violent or accidental event that happened to a loved one can be enough to trigger it. It's about the event's impact on your sense of safety and your view of the world. There are other factors that can put you at risk. Repeated exposure to traumatic details can also be a cause. Think about first responders, paramedics, police officers, firefighters, who see terrible things day in and day out. That cumulative stress can absolutely lead to PTSD. Your personal history matters too. If you grew up with a lot of chaos or had previous traumas, your resilience might already be worn down. A lack of a good support system after the event is a huge factor. If you feel alone in your struggle, the weight of the trauma becomes much heavier to carry. So how does this chaos show up in your day-to-day life? It can wreck your sleep. You might be afraid to fall asleep because of nightmares, or you might wake up in a panic. This lack of sleep makes everything else worse. At work, you might find it impossible to concentrate. You might be irritable with your co-workers or have trouble remembering simple instructions. Your job performance suffers, adding another layer of stress to an already overwhelming situation. It's a vicious cycle. The symptoms make life hard, and the hard life makes the symptoms worse. Your relationships will take a hit. That emotional numbness and irritability I talked about, that pushes people away. Your loved ones may feel like they are walking on eggshells around you. They don't understand why you're so distant or angry, and you don't have the energy to explain it. You might also experience physical symptoms like headaches, stomach problems, or chronic pain. Your mood can swing wildly. One minute you feel numb, and the next you're filled with rage or deep sadness. Your world becomes small, unpredictable, and scary. This isn't living, it's surviving. Alright, so you've got this problem. What are you going to do about it? You can't just sit there and let it run your life. You've got to stand up and fight. This is where a psychologist comes in. The first step is getting a proper diagnosis. A professional will sit down with you and really listen. They'll assess your symptoms and help you understand what's going on. Putting a name to the pain is a powerful first step. It tells you that you're not crazy, you're not weak, and you're not alone. This is a known condition with a known path to treatment. Then we get to the real work therapy. One of the most effective methods is cognitive behavioral therapy, or CBT. This is about identifying the negative thought patterns that are keeping you stuck. You learn to challenge thoughts like, "It was my fault," or "The world is a completely dangerous place." You replace them with more realistic and balanced thoughts. Another powerful tool is exposure therapy. In a safe, controlled environment with a therapist, you gradually confront the memories and situations you've been avoiding. This helps your brain learn that these triggers are no longer a threat. We also have to talk about coping skills. A good therapist is like a coach. They're not just going to talk about the problem, they're going to give you a playbook. You'll learn grounding techniques to pull you out of a flashback. You'll learn relaxation exercises like deep breathing to calm your body's alarm system. Group therapy can also be incredibly powerful. Sitting in a room with other people who get it, who have been there, can be a game changer. It shatters the isolation that PTSD thrives on. You learn from them, and they learn from you. A psychologist's job doesn't stop there. They work to prevent relapse. Recovery isn't a straight line. There will be good days and bad days. Your therapist will help you identify your personal triggers and create a plan for what to do when things get tough. They often work as part of a team, coordinating with your family doctor or a psychiatrist if medication is needed. And critically, they support your family. They help your loved ones understand what you're going through and teach them how they can be a part of your healing, instead of accidentally making things worse. Let me be crystal clear about something. Having PTSD is not a sign of weakness. It is a sign that you have been through something that was too much to bear. It is a sign of survival. A soldier doesn't get a medal for not getting injured. They get a medal for their courage in the face of danger. You have faced an incredible danger and you are still here. The battle now is an internal one, but it is a battle you can absolutely win. You have to give yourself permission to heal and accept that you deserve to feel safe and happy again. The most important message I can give you is that treatment works. I've seen it thousands of times. People who thought their lives were over, who were prisoners in their own minds, have found their way back. They have reclaimed their lives from the grip of trauma. It takes work. It takes courage. You have to be willing to show up and do the hard work, even on the days you don't want to. But on the other side of that work is peace. On the other side is a life where you are in control, not your past. Understanding is the first step toward healing, not just for the person with PTSD, but for all of us. When we know what it is, we can have compassion. We can offer support instead of judgment. If you see a friend or family member struggling after a difficult event, encourage them to get help. Let them know it's okay to not be okay. Offer to sit with them while they make the call. Drive them to their appointment. Be the support system that is so crucial for recovery. Your understanding can be a lifeline. So, what's the bottom line? The bottom line is hope. The pain you feel is real, but it does not have to be a life sentence. There is a path forward. There are skilled professionals who have dedicated their lives to helping people just like you. There are proven treatments that can quiet the nightmares and calm the anxiety. You took the first step by reading this and getting informed. Now, take the next one. Make the call. Reach out for help. You deserve a life that is not defined by your worst day. You deserve to heal.